Great. Now that we have done the middle direction stretching, if that's all you feel comfortable doing, that is fine. And you can move on to the next set of stretches. If you are able to do the multi-directional stretch, which I am about to show you, that will help loosen up some of the muscles on the side of your body and your lower back on both sides, and general stretching in the mid-back on both sides as well. So it would be your lats and your quadratus lumborum. So once you go down to the middle and do your 4 or 5 breaths, you can come back up, and then we can slowly rotate the table off to the side just slightly, making sure not to increase any pain, pinching, or discomfort in your lower back. And then we're just going to hang out here for 4 breaths as well. So inhale nice and slow through your nose. And then exhale nice and slow through your mouth. And as your body becomes accustomed and used to the motion that you're asking it to do, you can sometimes sink a little deeper into the stretch. Again, do not attempt this if you do not have the flexibility and mobility. Okay. And then slowly roll the table back up, swing it around to the middle, readjust yourself. If your laterals happen to be in the way, ask your rehab aide to help swing them away and see if that makes it better for you. Let's go and do the other side. So I want you to bend forward at the waist and then swing over to the side slowly and carefully. Drop your head, straighten your arms out as best you can, and really try to sink deep into that stretch so you can feel it in your lats or in your upper middle back and on the muscles on the side of your hips. Good. Now that we've done 4 to 5 nice, deep, slow breaths there, we want to come back to the middle. Now we can move our table out of the way or have our rehab aide assist us with that. Bring our laterals back in if need be. Now we're going to do just an upright seated mid-back stretch. So all I want you to do is, let's start with the left side. We're going to take our left hand, bring it around to the side of our armchair, or armrest here, sorry. And then we're going to take the right hand and bring it across and try to hold our armrest as well. So we're getting a nice gentle twist. I don't want to force the motion too much and increase any pain or discomfort, as I mentioned earlier with the other stretch. So while we're sitting here, let's do that nice slow breathing. Inhale slowly through your nose and exhale slowly through your mouth. And I want you to try to fill your belly with air when you're inhaling. Good. And slowly come back to the center before now we take our right arm, bring it over to the side. If you have handlebars on the back of your wheelchair and have the mobility and flexibility to do so, sometimes it's helpful to loop your arm around the back of that. Then take your left hand, hold the armrest, and gently stretch and twist towards the right direction. Keep your gaze directly, maybe not over your shoulder, but straight ahead. So we're going to take nice deep inhales through our nose, filling our belly with air. And exhale slowly through your mouth. Let's do 3 more breaths like that. Great. Now we have stretched out and gotten some nice looseness and decreased the stiffness in our upper back and middle back and lower back. Thanks for joining me today at MS Friendly Fitness for the Boston Home.